Okay, we're going to go ahead and get started. If everyone would like to take your seats. My name is Kerry Keel. I am one of the co-coordinators of this conference, and I want to welcome you to the first and hopefully annual National Symposium on Corrections Total Worker Health. I'm going to skip some formalities and introductions until a little later. I really would like to first give the honor to our Deputy Director of the Oregon Department of Corrections, Mitch Morrow, and let him welcome you to this. If anyone represents corrections, it's Mitch Morrow. Mitch is the heart and soul of corrections like no one I've ever met. And he's the second in command at Oregon. He's risen through the ranks. He's a native Oregonian. He holds a master's degree in business administration and a bachelor's degree in human resource management. He holds multiple certifications, and I know he has close to 30 years in corrections, starting as a CO. You must have started when you were about 8 years old, evidently, Mitch. 19. Yes, 19, okay. Well, again, without any further ado, I want to introduce our Deputy Director of the Oregon DOC, Mitch Morrow.
What an exciting day. What an exciting day. I recently started involving myself in the wellness for the Department of Corrections 31 years too late, quite frankly. But I just got to say, I am so happy this is happening in Oregon. And I first want to start off by saying major thank yous from Governor Kitzhaber and his office and Director Peters from her office as well. I mean, this is a top priority for both of them. And the fact that this symposium is happening in Oregon, what an exciting time for us as an agency and as a state. And then what happens across the country. I am... You know, you get asked to speak at a lot of things, and you present, and you kind of go up and, you know, you do your whatever you're being asked to do. This is passion for me. This is real. As you heard, I started out as an officer 31 years ago. I went through a training class, but I'm going to tell you what the real training was when I walked into that penitentiary. And by the way, my first 16 years were spent at the maximum security Oregon State Penitentiary. Started out as an officer, corporal, sergeant, lieutenant, captain, and then head of security, and then superintendent. So that's where I earned, you know, you earn your bones in some ways, right? That's where you pay your price and you grow up in the system. But here's my, I'm 19 years old. I walk into the penitentiary. You go through this formalized training. Then shift captain walks up to me, and here was his training of the day. Son, don't ever forget that every day is a potential Friday. Now, I'm just out of college. I don't know what the heck this guy's talking about. You know, he fits the classic mold of a, you know, prison, you know, shift commander. And I said, boss, what are you talking about? He said, well, today you might die. He says, or tomorrow you might die. Or the next day you might die. So every day is a potential Friday. So always be prepared. Then you're going to hear today, as you walk through some of the studies that have been done about that hypervigilance, it starts day one. And the minute that gate closes to the moment you go home, and after a number of years being acclimated to that, then it's in the restaurant. It's while you're on vacation. Your back's always to the wall. 31 years of doing that, I can tell you I had to find ways to balance that out. I thank God every day for my high school sweetheart and wife of 35 years and our 3 boys, and that's been my balance, and that's kept me grounded for sure, because I don't mess with her. I'll mess with an inmate any day, but I will not mess with her. But it's an incredible... it's an incredible burden to carry, and we've yet to this day, we've not done well finding a solution to manage that. But here's the outcome in Oregon. We have the highest worker comp claims in the state. In 1998, when I became a superintendent, the average annual sick leave of a corrections officer, a corrections employee, or uniformed staff, this is unscheduled leave, was 8 days a year. They accrue 12 days a year. By 2013, that was 17 days a year, more than double. Now, set aside the human side of this equation and just go to the financial side of the equation. There shouldn't be a CFO across the country that wouldn't say, wow, we're throwing away millions upon millions upon millions of dollars of lost efficiency, overtime costs, and the list goes on, let alone medical costs and everything that goes with that. But now jump back to the human side. Alcoholism, divorce rate. I was talking to a group the other day that came to Salem. In an 18-month period, we had 4 staff suicides. That's bullets to the head suicides, right? Now, that's in a community of 4,500 people. Now, if that was cops, firefighters, college professors, you name the group, any group of 4,500, 4 suicides in 18 months, it had been in every media outlet across the country. Guess what happened in Oregon with 4 staff suicide in 18 months? It's corrections. Nothing. Absolutely nothing. It's broke, folks. It's broke on multiple levels. Add to that the Hollywood spin on corrections, corrupt wardens, corrupt staff. Add to that the media side of it where corrections officers too long to spell, so we're just going to use guard. We've been telling them 31 years guard is offensive. Might as well call cops the fuzz, right? But you know the editorial person in charge of headlines won't change guard because it doesn't use as much ink. And I can go on, and I can go on, and I can go on. But let's get away from all that and talk about what we can do about it. And I can tell you we are extremely excited about what the work of PSU and OHSU. And we are so grateful to doctors Carrie Keel, Leslie Hammer, and Charlotte Fritz. These people are doing some incredible work for the Department of Corrections. The early results are really putting out a clear picture of what's not working and the steps that we need to take, not only as an agency, but as a country, for people that walk, in my opinion, the toughest beat in public safety. There is no doubt in my mind it's the toughest beat in public safety. And so I'm excited about what the symposium is going to do for our employees, what it's, again, going to do for the organization as a whole, and what it's going to do for the state on the financial side if we get it right. And it's really important that we don't forget the families of these people as well, because if they're damaged, then the damage goes into the community through their families. So it just continues to compound itself over and over again. And I'll frame it up. We've tried on multiple occasions to get this right, and you're going to flash a card when and by the way, I promised Dr. Keel I wouldn't swear this morning, so I want you to know I have a tendency to get a little excited. So yeah, all right. Yeah, thank you. Well, you're welcome. So here's how we try to do it, and we're not good at it. So again, these are personal experiences. This is 96. There's an execution at the Oregon State Penitentiary. I'm head of security. I'm preparing the institution. We have an execution team. We go through the process. No reason to get any of the detail around that. We start at midnight, so you're already late in the night, and things are happening at a weird time and weird hour. The execution is completed, and we move on beyond that. And my last job of the night is to unplug all the hoses and bag the body. So here I am down in our Supermax execution chamber, state police and myself, one state police officer and myself. He fingerprints, he leaves. I start pulling the tubes, throw the tubes in the bag, zip up the body bag. Now here's something you need to understand. As a sergeant in segregation, it's what we typically call the hole if you work inside of an institution. I actually worked with these two guys that we executed in 96 and 97. So there was a rapport that I had that was way beyond anybody else that was involved in this process, right? That's why in some systems they actually move the inmates to a different institution and then move them to another location for the execution. Well, that wasn't the case back in 96, 97. It really was the Oregon State Penitentiary, so they lived there. So I'm bagging the body. I get all done. We zip it up. We put it on a gurney. We hand it over to the funeral home. And then I walk down through the penitentiary. Again, now it's 1 a.m., something like that. And I'm going through the penitentiary, and I get down to this conference room. And open the door, and in the conference room was the director, assistant director, superintendent. I think there was one other official, myself, and then a clinical psychologist. And so they had a little circle, like we're kind of sitting here. And I came in. I was the last one there because I had to do what I had to do. And I sit down, and the psychologist says, "So, how's everybody doing?" Now, I said, "Can I go home and go to bed? Because I'm kind of done." And do you think for a moment I'm going to express anything in front of my 5 bosses or 4 bosses at that moment? See, that's how we try to do it, right? We try to put it out there and walk through a process of care. And I'm not saying anybody did anything for the wrong reason. We just keep getting it wrong. See, our staff, let's go to our uniform staff, they're certified. You need to understand they have a certification they have to protect. So when you tell them to go get help, they're going to say, "Where?" Because if I say too much, I lose my job, right? And if I live in these small communities, so Oregon has prisons in small communities across the state, you're going to walk in through our EAP program, right? You all know what EAP programs are, and you walk in and you see a counselor. Well, then you leave that EAP interaction, and you've just said that you're kind of suicidal or you have an alcohol problem, And then you see that person in church, or your kids go to school with their kids, right? Or you see them at the county fair or whatever, because you're in so guess what our staff aren't going to do? It's not going to happen. So we haven't got that right either. We don't have a professional, I don't know what the technical term is, but when a professional person gets in trouble, lawyer, doctor, they have places they can go to where the confidentiality is maintained. They don't lose their license or their bar card, right? And they can, guess what corrections has? Nothing. And guess what we all are? We're mandatory reporters. And so if somebody walks in my office and says, I have a cocaine addiction, guess what my obligation is at that point? It's a mandatory report. So now their certification's in trouble. We have to find a way to get through this. We have to find a way to get past these barriers, or our people will continue to suffer, and we'll continue to have the suicides and the alcoholism and the high divorce rate and all the other things that go with people trying to medicate and care for themselves. So I am absolutely, I don't even know what word I could use to describe what you folks are going to be doing here, and that you're here today, and what OHSU and PSU is doing, because the outcome of that is saving lives. The outcome, and it's simple things, really. I mean, what the beauty of what we've gotten early on is that there are simple things that can be done that make a difference. But here's what you always have to be cautious of. I'm not going to, when I was, so just to give another snapshot of myself, I was on what we call our tactical team, is the SWAT team in other organizations. I was on that team for 8 years. I was a member of the team for probably 5 to 6, and then the commander for the last 2 or 3. And do you think any of those people were going to show weakness? It was not going to happen. They weren't going to show weakness to their shift commander. They weren't going to show weakness to me. I wasn't going to show weakness, because we might be putting a weapon in your hand to go rescue a hostage. So you have nowhere to go to deal with whatever stress you're trying to handle. And I'm as guilty as the rest. I'm going to tell you, we had a hostage situation. I'm a deputy director. I'm in my current capacity. We had a hostage situation at the penitentiary. I saw the commander, just had a chance to catch the commander 3 minutes before they were going in. And I grabbed me by the collar. And here were my words of wisdom to the commander of our SWAT team. Pick the best shot and make sure the kill shot is effective. Get our officer out of there. Right? Now, do you think I followed up after that? I never followed up after that. We got them both out, by the way. We got them both out, but I never followed up. Imagine the pressure I put on that commander. And imagine the pressure that commander put on whoever he was going to go say, hey, the boss just said, if you're going to fire a kill shot, make sure it's effective. My mind was telling me protect the officer. At all costs, get that officer out of there. What I forgot to do is go follow up with that commander and that team afterwards, knowing that I put him in a position where they might have to take a life. Having had to be, I came that close to doing that myself, finger on the trigger. The inmate decided he didn't want to die that night, so I didn't have to pull the trigger. One of the greatest things in my career was never having to pull the trigger. No follow-up. We had a meeting the other day, and am I getting close? So you tell me if I'm, okay. See, I can go forever. One last piece, and this is something to keep in mind as you walk through this. And I thought it came up in our meeting the other day, and I thought it was really a powerful statement. What is a successful day in corrections? How do we define success? And so the individual, I think, brought up the execution. I said, well, the execution was successful. He says, well, is that a successful day? You get out alive. Is that a successful day? What does success mean? And that's the standard we've placed on people in corrections is unbelievable. And we live by the 95-5 rule. 95% of the time routine, 5% sheer terror. So we're always preparing for the sheer terror. That's the hypervigilance. And lastly, then, the rule of 3. By the way, these are non-scientific metrics. The rule of 3. Homicide, suicide, and a staff just got assaulted. Okay, that's 3. Everything comes in 3s. Now we can take a break. That's how we prepare ourselves for the next 3. Right? So there's the rule of 3 and there's a 95-5 standard. None of them work. And there's no science behind either one of those. But we try to find a way to get ourselves through this process. Again, so I'll end this. Thank you. Because without you, this conversation doesn't go on. Without you, we don't get to a better place. And without you, we don't save our staff. So I appreciate you being here. Thank you for inviting me up. Please go after this with all the venom and vigor that you can muster, because we need your help very much. Thank you very much.